My name's Angie Davidson and I'm the Campaign Director for the St Thomas Lupus Trust. The Trust was set up in 1991 specifically to help lupus patients and actually to fund all the research into lupus at St Thomas's Hospital. Lupus is an autoimmune illness. Basically, the immune system's gone into overdrive with a lupus patient. Normally, if you have something like a cold or flu, the immune system will come out and try to fight it. In the case of a lupus patient, the immune system has no control. It doesn't know how to stop. In the worst case scenario, it will try and attack the internal organs, which obviously can be fatal. With lupus patients, there's 90% of them are actually female. Also, it affects different ethnic groups in a different way. So, for example, with me, I have lupus, and I had about a 1 in 700 chance as a Caucasian female of getting lupus, but this actually drops to 1 in 200 to 250 if you're either an Asian lady or an Afro-Caribbean lady, so it is much more prevalent in some groups. Men do get lupus, as do children, but the main group of lupus patients are women aged between about 15 and 45, which is the prime of life. There are two basic types of lupus. One is the systemic, which is the one that affects the internal organs. The other one is discoid, which affects the skin. And people will remember that Michael Jackson used to hide under a parasol. He actually had discoid lupus, which was discovered when he burnt his head during a Pepsi advert. That actually was then proven to be discoid lupus, and he was actually keeping out of the sun by staying under the parasol. The other person that has discoid lupus is Seal, the singer, and all the scarring that he has on his face was actually caused by the discoid lupus. And lupus is something that waxes and wanes, so it comes and goes. So some days are much worse than others. On a very bad day, when you have what we call a flare, it feels like you've got a really severe form of flu. So your joints are aching, it feels like you can't get out of bed, you could sleep for 24 hours and still feel tired. So it's that kind of feeling all the time. But that, as I said, does come and go. So you have to learn to pace yourself. The other thing you have to try and avoid, and it's very difficult these days, is stress, because stress is one of the triggers for lupus, and also it can trigger a flare. So if I talk to a patient who has perhaps been going through a rough time, they've lost their job, there's perhaps been a bereavement in the family, then that generally will cause a flare, because it's your own immune system coming out to help you fight all these feelings. Lupus is often called the mimic illness because it mimics other illnesses. The symptoms are often vague, and that gives the doctor not much of a chance of diagnosing it immediately. So a lot of people are misdiagnosed. In the UK, I know that it takes an average of 4 years before you actually get a proper diagnosis for lupus. And as I said, that is down to the fact that it's a very vague sort of symptoms. People will go feeling generally unwell, they know there's something wrong, they're feeling depressed, they're aching. It's all the kind of things that could be any other illness. It can be actually diagnosed with certain blood tests and obviously with a history of the patient, but it is difficult to diagnose. The first thing we do when we have a patient that's diagnosed with lupus is to try them on antimalarials. Strangely, antimalarials do calm the immune system down and will often calm the lupus down as well. If they don't work, we will try steroids, and if they don't work, we try chemotherapy, which is a far more aggressive treatment. Obviously, each patient is different, so we can't just give all the patients the same medication. There are a lot of things that lupus patients can do actually to help themselves. Things like diet and lifestyle obviously will help. So things like smoking is very bad for lupus because already your lungs are under threat, so that wouldn't be a good thing to do. Exercise has been proven to help with lupus patients, as does certain types of diet. So healthy eating, general healthy diet, and things such as a bit of exercise all help. I'm often asked what the lifespan is of a lupus patient, and to be honest, about 20-30 years ago you would be diagnosed with lupus and you'd be told you had about 5 years to live. Now obviously, due to the immense amount of research that is now done into lupus and a better understanding, a lifespan can be a normal lifespan and patients can live as long as anybody else does. It obviously is down to how severe the lupus is and whether it actually attacks the internal organs. We need to carry on with this research because we've moved in the advances so much now that we can actually calm the immune system down, but we need to know what causes lupus and whether there is a way of actually stopping lupus from happening. So we very much rely upon donations from people to carry on with the research, as we don't get any funding whatsoever from any other source apart from the kindness of people.